Let's now welcome Dr. Jeff Coury of Coastal Carolina ENT. Well, welcome to the show today, Dr. Coury.
Thank you.
It's great to have you here. Well, for our viewers who may not have met you, I'd like to first learn a little bit about you and your practice. How long have you been here in the area?
I've been here approximately a little over 3 years after I joined Coastal Carolina Ear, Nose, and Throat.
A little over 3 years. Well, where were you prior to coming to this area?
I was originally born and raised in Scranton, Pennsylvania, and I did my medical training in Philadelphia.
Oh, well, you mentioned your medical training in Philadelphia. Let's talk a little bit more about your background, your education, and
Sure.
how you got to where you are.
Sure. I did my undergraduate training at the University of Scranton, and then I moved to Philadelphia. I did my medical school training at Philadelphia College of Medicine, and then my residency training of 5 years in ear, nose, and throat at Hahnemann University.
Hahnemann, good school.
Thank you.
Well, let's talk about your practice. Where are you located?
Right now we have 2 offices. I'm part of Coastal Carolina Ear, Nose, and Throat with 2 other partners, Dr. James DeMuzio and Dr. Kenyon. We have an office in Whiteville and a new office in Charlotte.
I believe you used to be in Sunset Beach.
That's
Is that
correct.
the office that has relocated to Charlotte?
That's right. We were in Sunset Beach for approximately 3-4 years. The practice grew. We wanted to be closer to the hospital, so then we moved to Charlotte.
Wow. Well, that's nice. Well, as an otolaryngologist, you specialize in the treatment of ear, nose, and throat, correct?
Correct.
Well, today I'd like to concentrate our interview on hearing loss or hearing problems that happen in the ear. So I imagine the most common thing is hearing loss. Is that correct?
That's correct. We see quite a lot of hearing loss in our office.
Really? Well, what causes hearing loss?
It's complicated. I think the best thing to do is to break it down into 2 different types of hearing loss. There's a conductive hearing loss, and then there's a nerve or sensory neural hearing loss. And in order to understand a little better, we'll go over the pathway of sound. So sound enters the ear through the ear canal, and then it vibrates the eardrum. The eardrum vibrates the bones behind the eardrum, and they're called the ossicles. Those little bones send a pressure wave to the end organ, which is called the cochlea. And the cochlea is basically the nerve organ. That nerve organ sends a nerve impulse to the brain, and then we perceive it as sound. So any breakdown in that pathway causes a hearing loss. So for instance, a conductive hearing loss could be caused by wax impaction in the ear canal, or fluid behind the eardrum, or holes in the eardrum. A nerve or sensory neural hearing loss could be caused usually from advancing age or loud noises or viral infections. Rarely can you have a tumor that can cause that problem as well.
Wow, that sounds complicated. Lots of steps there.
Lots of steps in the
that you
pathway.
have to go through. Well, how do people begin to realize that their hearing is going?
Usually it's a gradual phenomenon. They notice that they had to turn the television up louder over the years, or that they're having a problem in crowded conversations such as meetings or restaurants. They just can't decipher things that go on. So normally it's a gradual phenomenon for adults. There is something that's important to point out for the community. It's called a sudden hearing loss. Some of my patients wake up and they can't hear at all, and that's important that they seek medical attention right away with an ear, nose, and throat doctor so that the proper treatment can be employed to help save the hearing. Most of the time it's not the patients that voluntarily come in. It's usually the spouse that drags them in because
the TV's driving them
exactly,
crazy,
the TV's driving them crazy. They're turning up so loud, or they just don't understand me or hear me any longer. So.
They don't listen.
That's right.
But you said it can be gradual, so I guess it could be so gradual you don't realize it for a long time.
That's right. And like I said, usually the spouse picks up on it because if you're turning the television up slower and slower, you're coming accustomed to it. But the person who doesn't have the hearing loss notices it. Yeah.
So if someone is noticing that their hearing is going, they're losing it, what do you recommend that they do?
Well, come see me. This way they can have a detailed history, physical examination, and a detailed hearing test by a certified audiologist to kind of pinpoint where the breakdown in the pathway is occurring.
And do you have an audiologist there at your office?
We do at all times. There's 2 certified audiologists that do certified hearing tests as young as age 6 months to as old as
Really? So they do them in children as young as 6 months?
That's correct. That's correct.
Wow. And there's somebody there all the time
All
for
the time.
that?
Yes.
Well, what treatments are you able to provide for people who are experiencing any kind of hearing loss?
Well, once we figure out where the breakdown is in the pathway of sound, then we can treat it. Certainly, if it's as simple as wax impaction, we can remove it in the office.
And you would do that?
Exactly. And some of my patients have chronic ear infections where they need medical treatment and or surgical treatment to help repair the eardrums. Certainly, if it's a nerve type of hearing loss, then we can offer them hearing aids.
Do you have any recommendations to prevent hearing loss?
Absolutely. Ear protection is paramount.
Really?
Yeah. Nowadays, well, especially with hunting season, we see it all the time where hunters are out and they use their guns and rifles and they don't wear ear protection. And it's common that I see them years later because now they have a hearing loss because they fired a gun 20 years ago without ear protection. So it's very important that they know to wear ear protection. Absolutely.
Does it matter if you're just near somebody or if you're shooting the gun and it's near your ear? Is that when it occurs?
Yeah, usually it's between friends where one fires the gun and the other one didn't have ear protection in. So if you're around a loud noise, you need to carry earplugs. Absolutely. And even as simple as yard work, if you're using a weed eater or you're on a tractor, you need to wear earplugs because over the years it'll catch up with you.
So anything that makes a loud noise, we need to be
aware of it and wear ear protection. Absolutely.
Cutting the grass, huh?
Cutting the grass.
No wonder my husband can't hear. I just thought he didn't listen to it. Well, I also hear a lot of people, especially adults, talk about ear ringing. They say they can hear, when it's very quiet, they can hear a ringing sound in their ears. So is that kind of common?
Quite common. It's called tinnitus, and different people perceive it different ways. It could be a ringing in the ears that's constant or a pulsatile ringing in the ears.
What's that?
It almost goes with the heartbeat. Instead of a long, continuous ringing, they hear a kind of a whooshing sound like the heartbeat. Some people swear they hear the ocean in their ears or a cricket or an insect. So it's perceived differently by different people, and it's called tinnitus.
Oh. Well, what causes that ringing?
About 90% of the time it's due to hearing loss. It's the little nerve cells in the ear causing a ringing sound to the brain. But there are other causes such as medications. If you're on high-dose aspirin can cause it, or if you use IV antibiotics can cause it. Endocrine dysfunction and malfunction can cause a problem such as hypothyroidism or hyperthyroidism. Certain types of tumors and ear diseases can cause it as well. But most of the time it's due to loud noises and or advancing age with hearing loss.
Can you treat that?
You can first identify the cause. If it's endocrine dysfunction, you can treat them that way. If it's medications, you can get them off of the inciting agent, the inciting medication for that. But normally, if it's due to loud noises, you can dampen the tinnitus, but never really remove the tinnitus. There's certain techniques that you can use, such as masking techniques. Usually, people hear tinnitus when it's quiet. So if they're laying down and they hear the ringing in the ears, they need to introduce another noise so that they can go to sleep that's a little bit more soothing, like the television or the radio. There's certain over-the-counter medications that can help too.
Well, I think we've pretty much covered adults, so I would really like to switch gears now and to talk specifically about situations that occur with children. And you do see children, correct?
Absolutely.
Well, let's talk a little bit about ear infections and things like that. I know personally my children had a lot of ear infections when they were younger and ended up with tubes. So let's kind of start there and talk about that.
Sure. Children who have ear infections usually have a problem with the eustachian tube, which is a ventilation tube behind the eardrum. And when they're born, the ventilation tube is flat, and as they grow, there are kind of angles, and the muscles around the tube and the cartilage basically gets more mature, so they don't have ear problems. But initially, children can have ear problems due to that eustachian tube. And it's normal for kids to have 1 or 2 or 3 infections in a year. That's normal from a viral standpoint. But if they start getting more infections a year, 6 infections per year, they need to be evaluated by an ear, nose, and throat specialist. And the reason being is because chronic ear infections can cause a hearing loss. Whenever there's an ear infection, there's fluid behind the eardrum. And if the children have fluid behind the eardrum. It's like they're hearing underwater, and that's what they'll produce as speech. So a lot of children will have speech problems from that.
I
So it's
didn't
quite
realize that. So they could mimic what they hear?
what they hear.
Wow.
And if they hear something garbled, like they're underwater, then that's what they'll mimic. They won't really have good speech or age-appropriate speech. And when I see them in the office, I evaluate them with a hearing test and with an examination. Certainly, some children have fluid in the ears for over 3 months, and that's an indication for surgery for tubes that I place in the eardrum.
Let's talk about those tubes a little bit.
Sure.
I've heard parents often say they fall out. Do they fall out or do they grow out? How does that work?
The tube is structured so that it looks like a spool. And what happens is when the eardrum sheds its cells, it collects underneath the spool and it timely comes out in a fashion, usually 6 months to a year. Certainly you don't want the tube in there longer than 3 years because that can cause a permanent hole in the eardrum. So they're designed to come out in a certain time period. And once they come out, then the child can be reevaluated to see if their eustachian tubes actually mature enough that they won't need tubes anymore.
But might they need to be put back in certain cases?
In certain cases, yes. There's many children out there that I'm treating, and they're now in their teenage years, and they've had 6 sets of tubes. So it just depends on when that eustachian tube actually grows up and matures.
Well, how would a parent know if the child wasn't hearing properly? If, for instance, it's a young baby, how would they know that, or what would be some of the things they could do to determine that the child wasn't hearing?
Well, now with pediatricians and their well checks, it's they have checklists for the parents that they actually should have certain milestones, which helps quite a bit. Certainly, if the child isn't moving his or her head to loud noises, it could indicate a problem that they might have been born with hearing loss, which is quite common, or having a long-term infection in their ears. If the child isn't saying 1 or 2 words by the age of 1, there's certain checklists set up by the pediatrician, which is very good in this area, to find out if they have age-appropriate speech. And the pediatricians in this area are very good about referring them to me to see if they have a problem with their speech, or if the problem is behind the eardrum with ear infections, and then they can get evaluated appropriately.
Do they do ear checks in the schools? Do the grade schools check for hearing loss, things like that?
Yeah, absolutely. After they visit the pediatrician, the kids grow older, they sort of lose touch with them. So when they enter school, they do have yearly audio checks with an audiogram, and the schools are excellent about if the child fails the hearing test, usually 2 times, they'll be referred to my office for a more detailed evaluation with a more detailed audiogram study and an examination by myself.
And children that young, say 6 months to a year, there are hearing aids appropriate for children that young?
Usually not hearing aids at that age, but the hearing test that we can do, first of all, we do hearing tests with young kids from 6 months to a year with the parents so that they can respond appropriately. After a year old, we kind of play with them in the office to see if they can hear and have them do certain tasks. The age of hearing aids that can be appropriate for children are usually at the school age, so that's when we start to employ hearing aids for them.
Wow. Lots of good information, Dr. Coury. If folks out there would like to set up an appointment with you, how can they reach you?
Multiple methods. We are setting up a website, but initially it's to call our office. It's 910-755-3682. Our Whiteville office is 910-914-0540.
Great. And you're setting up a website, you say?
Correct.
Great. Well, thank you so much for being here. You've been a great help, and we've learned so much from you. So thanks so much for being here.
Excellent. Thanks for having me.
You're welcome.